So, hello everyone, my name is Mukhi. I am the Executive Director of Doctor Interested. We're so glad you could join our webinar series today. A few housekeeping things. Make sure your cameras are on if you're comfortable. It just helps create a sense of community. Please remain muted unless you're speaking and stay engaged. You can do this by raising your hand or by putting questions in the chat, and we'll get to them during the Q&A period at the end. Before we begin, we would also like to acknowledge that this event is being organized in Mississauga, Ontario, which is situated on the traditional and treaty territories of the Mississaugas of the Credit First Nation. And as we gather virtually today, we encourage all of our participants to reflect on the lands they are joining from and to recognize the enduring presence and contributions of Indigenous peoples across Turtle Island and the world. With that, I am very proud to introduce our speaker for today, David. He is an MD PhD candidate in his third year at the Virginia Commonwealth University in health policy. He's published more than 60 peer-reviewed papers on healthcare delivery, behavioral economics, and substance use disorders, with his work featured in the Lancet, JAMA Internal Medicine, and many others. He also serves on the editorial board of the PLOS One, and David's contributions to addressing the drug overdose crisis have been recognized by the Diana Award, the Boston Congress of Public Health's 40 Under 40 in Public Health Catalyst, the National Minority Quality Forum's 40 Under 40 Leaders in Minority Health, and the U.S. Public Health Service's Excellence in Public Health Award. Most recently, David was selected as a delegate of the 8th Lindu Nobel Meeting in Economic Sciences in Germany. Today, he'll be sharing with us his experience in the MD PhD program and sharing about medical ethics and the CASPer test and careers you can have as a research scientist. With that, I'm proud to give it over to David.
All right. First of all, thank you so much, Adel, for the invitation to join this seminar. Just to give you guys a quick rundown of what I'm planning to talk about today. As Adel mentioned, I'm an MD PhD candidate here at VCU, and what that means is I'm doing both my MD degree, which is medical school, as well as my PhD, which is graduate school and research. So whether you're interested in medical school, research more broadly, or just STEM, I'm happy to sort of touch on all of those aspects and hopefully leave some time at the end for questions. All right, so I grew up in Canada and I went to Western University for medical sciences. But actually, I wasn't initially interested in medicine at all. I was primarily interested in pursuing a degree in either architecture and engineering. But in grade 11, I actually had the opportunity to participate in something called the Brain Bee. For those of you who might not be familiar with what that is, it's a neuroscience competition that was hosted in the city where I grew up, Ottawa. And we had sort of these weekly meetings where we learn about the brain, different like neurodegenerative disorders, and sort of bridging that connection between research and science, or research, science, and medicine. And I was like absolutely fascinated. I still remember like during the actual competition, we got to meet with like two or three patients or like what we call standardized patients. So they're essentially actors who pretend to have certain medical conditions. And we got to question those patients and like learn about their different symptoms and sort of provide some differential diagnoses on what they might have. And I thought that was like such an amazing and rewarding pathway for me, just because you really are at such a like unique precipice of being able to intersect like what you're learning through class lectures, through like advocacy, through like science and biology and all of those things, and actually apply it to helping patients, and you get to form a relationship with them, which is I think is incredibly unique. So at that point, I was like, I don't think engineering is like the right path for me anymore. I need something where I can like wake up every day, like talk to people, get to know them, and hopefully make them feel a little bit better. So that's when I actually decided to sort of pivot to the medical sciences route, and I took a summer course in biology, and I loved it. And I decided to apply to this program for university. I selected the Western Medical Sciences program for a few different reasons, but the topmost reason I think is the flexibility it gives you. So it pairs foundational training in biomedical sciences with the flexibility of sort of tailoring it to your specific interests and choosing a specialization. So, for those of you who might not be familiar with Western's program, the first 2 years you're taking the same courses as everyone else in the program. So, for instance, like in first year, biology, chemistry, calculus, second year, organic chemistry, biochemistry, genetics, and all of that. And those first 2 years are extremely foundational since if you're applying for medical school, you will need to take an exam called the MCAT, which is the entrance exam. And those 2 years are essentially meant to prepare you for the MCAT and give you the breadth of knowledge you need to take that exam. So technically, after your second year, you should have all the skills that you need in order to take that exam. And that's actually what a lot of people do. So they finish their first 2 years and they start studying for the MCAT the summer after their second year. And a lot of people either choose to take their MCAT at the end of that summer and therefore be able to apply to medical school during their third year, or sort of gives them a leg up so that if they choose to apply during fourth year, they will have already written the MCAT and will have more experience. So that's what I did. I finished my first 2 years at Western. I studied for the MCAT, took the MCAT. And then during my third year, I was able to specialize in a concentration. So as I mentioned before, this program is really nice because it combines foundational training, which was those first 2 years, with flexibility. So your third year is when you start having that flexible aspect where you can choose a specialization. There are many different specializations you can choose. So for instance, pharmacology, physiology, microbiology, those are common and very popular specializations. I kind of went a very uncommon route in that I chose to go in epidemiology and biostatistics. And for those of you who might not be familiar with what epidemiology is, it's essentially the study of population health. So how do disease patterns and disparities evolve over time? So for instance, in the US, why do we have the highest maternal mortality rate among all developed countries? Those are the types of questions that epidemiology is interested in. So sort of applying a systems lens to medical sciences. And the reason I chose that specialization was actually because of the COVID pandemic. During my first year, I was, very ambitious, and I was like, you know what, I'm gonna apply to like as many internships and fellowships as I can. I would ideally love to do something in the U.S., and I was fortunately accepted to something called the Harvard summer immunology program for undergraduate students, which supports an 8-week internship at Harvard Medical School. And I was all set to go to study schizophrenia using mice models. And I was very excited for this because, as I mentioned before, I came from a neuroscience background, and that's what I really wanted to explore. Unfortunately, as you guys know, like in March of 2020, I'm sure all of your classes just were stalled and people couldn't travel anymore, they couldn't see people in person anymore, and as a result of that, unfortunately, my internship got canceled. So I was really honestly, I was like so bummed out for this. I was like super excited to go to Boston that summer to meet like other students in this program and to advance my understanding of neuroscience and biomedical sciences through lab work. But because I wasn't able to go anywhere and I was stuck at home, I had to be a little bit creative and think about how I could continue contributing to research even without being there in person. So I ended up picking up a position under Dr. Kuman and Wilson's lab at the Ottawa Hospital, where we studied the impact of COVID vaccine like hesitancy on the pandemic. And I really liked it. I love that our research was very relevant. It was very timely. It was addressing issues that people are currently, like sort of grappling with and being able to sort of provide empirical data to support policy decisions. So that's what really gave me like a 180 from biomedical sciences, so predominantly wet lab research, to public health research, which is predominantly dry lab and interested in not just mice models, but the models of population health as a whole. And that really cemented my interest in getting specialization in epidemiology and biostatistics. So I did my third year at Western, and during that time, I applied to both medical schools and graduate programs in public health, so MPH programs, Master of Public Health programs. So I applied to four different medical schools in Canada. I applied to University of Ottawa. I applied to McMaster. I applied to University of Toronto and Queens. The only reason I didn't apply to Western is because they require you to have a four-year degree. So being in my third year and sort of wanting to graduate early, I was not eligible to apply to Western. I believe also they may have changed this, but at the time I was applying, Northern Ontario also required you to have a four-year degree.
Mm.
So that also discouraged me from applying there.
Yeah.
I would have also loved to go to school at UBC, but I think, or you know what, I think I actually also did apply to UBC. So five schools in total. And I was waitlisted at University of Ottawa and Queens. So, being waitlisted, I then, continue to, interview for my master's programs. And fortunately, I was accepted to all of my master's programs. So I applied to four programs. I applied to Harvard, Yale, Columbia, and Dartmouth. And fortunately, I was accepted to all four. And Harvard and Yale were my top choices. But after talking to students at both schools, I eventually found out I felt that Yale was the best fit for me just because of how like community oriented it is and just like how collaborative it is. So I ended up choosing Yale, and I absolutely loved my experience there. It was like the most incredible like academic year of my life. Like we were a class of like 250 people. We had students from all over the country, sort of coming together and like combining ideas. We had people from all over the world. We had actual doctors from places like Rwanda, like Ghana, Uganda, India, and like so many other countries. And when we talk about like different health crises there, these physicians and other students were actually able to exchange like their personal experiences and why those health issues matter so much to them. And that was just so fascinating for me. We would literally have like global health on tap events where we go to like a local bar and just like listen to global health experts. We had the Surgeon General come. We had like tons of like really accomplished people in their fields, Kimberly Crenshaw, and so many others just join us and give talks. And it was just such a foundational experience. And coming from, I think the thing that stood out to me most is the difference in sort of mindset because when I was in undergrad, all people were talking about was getting into medical school. Like people who got into medical school after 3 years, so essentially they finished early, was like the ideal. If you could trim a single year off of your bachelor's, you were regarded as like a super accomplished, like super high performing person. And everyone was sort of in this like rat race to try to finish or try to finish undergrad as soon as possible, try to finish medical school as soon as possible and become a physician. Um, after moving to my master's program and after moving to the US, I am so thankful that I took that year off to do a master's program because it provided me with so much perspective on like being a physician is really awesome, but having the time to like understand, you know, why patients can't afford prescription medications that you're prescribing them, why patients are, dealing with certain chronic conditions. It's not just medical, it's not just access to medications, it's not just access to surgeries and all of those things. It's diet, nutrition, exercise, access to like green space, access to like um, local supermarkets and grocery stores where they can buy food that is nutritious and healthy and not ultra processed. These are the systems level factors that are actually determining much of population health. In fact, clinical medicine, so what you deliver through the hospital, only accounts for about 20% of health outcomes. That other stuff, what we call social determinants of health, is actually what accounts for that 80%. And being able to talk with students and sort of pause and reflect and sort of just completely change my perspective on healthcare delivery, that was just absolutely foundational. So during that year of a master's program, with that new perspective in mind, I decided to pursue and apply MD PhD programs in in health policy. So really taking that public health lens. I will say this is very uncommon. Most MD PhD programs are in the biomedical sciences, so involving wet lab research like neuroscience or pharmacology or chemistry. Public health policy is a lot less common, but it's a growing field. And if you're interested in both, I definitely want to encourage you to apply to these programs because you don't have to choose, right? Like if you are interested in both patient care and research, it's not like you have to choose only one of those. You can absolutely choose both. And even if you choose to do only medical school, for instance, you can definitely still be involved in research that informs policies to address these public health problems. Um, so why did I apply for MD PhD instead of MD? Well, there are a few different reasons. One, MD PhDs are a fully funded program. So in Canada, med school is expensive. It's like $25,000 to $30,000 a year. In the US, it's prohibitively expensive. If I were to pay out of pocket for my school right now, I would have to dish out $90,000 US per year, which is absolutely insane. I don't understand why school is so expensive here in the US. That's a topic for a completely different time. But if you're an MD PhD student, you go to school for free. They pay for your school. They pay for 100% of tuition fees. And on top of that, they give you a $2,400, or at least at my school, it's about $2,400 living stipend to pay for rent, pay for groceries, and those kind of things. And they also give you health insurance. So the trade-off is, instead of a 4-year MD degree, you're now doing an 8-year degree for an MD PhD. So it's 4 years of medical school and 4 years of research training. And you kind of have to think of it as like a full-time job, right? You're no longer just a student. You're actually, as a PhD student, you are contributing to the research engine of that school. Your advisor, your PhD advisor, you are helping them with their research and sort of moving things along. So that's sort of the way I think about it. But of course, there are trade-offs as well. If you finish med school after 4 years and you can get into residency earlier, obviously you start collecting your paycheck earlier, and that makes a big difference because attending physicians make like 300,000 a year. So by delaying, being an attending for 4 years, you're also sort of foregoing the opportunity cost of, having that salary for an additional 4 years. But overall, all things considered, I definitely do not regret my decision. I think it's an amazing program to balance out my interests in public health and in medicine. I'm so grateful for the opportunity to not only, give like a GLP-1 agonist to a patient who maybe has like an elevated BMI or has type 2 diabetes, but also address, the root causes of why, some patients are not able to access GLP-1 agonists, whether it's financial reason, whether it's baked into the insurance system, maybe there's prior authorizations that are denying them access to GLP-1s. I'm actually able to address these real world, real time issues and being able to advance policies. And I think that's so, so rewarding. So, as Adol mentioned, my research interest is actually primarily in substance use and pharmacoepidemiology. So I study addiction a lot and access to addiction treatments and why the US overdose crisis has persisted for so long. And a new area of research that I've recently sort of stumbled into is pharmacoepidemiology, which is the study of prescription medications at a population level. So why like why do prescription medications cost so much in the United States? Why do some patients not have access to medications? Those are sort of the fundamental questions that I'm interested in. So I think I will leave it at that. But I think my overall message is whether you are interested, and I know a lot of you are also high school students, so when thinking about the types of programs that you will be applying to for university, and for medical school, just think of it as like there's no one single route. Oftentimes, you will be surrounded by like-minded people, and that's great because you find community in those kind of people. But oftentimes, it can also create echo chambers. And only after stepping outside of an echo chamber did I realize I was actually in one in the first place. All of my friends were just trying to get to medical school as much as possible or as soon as possible, because that was the barometer of success. getting into medical school after 3 years was idealized as, the perfect student. But after stepping outside of that bubble, did I realize there's absolutely no need to rush it. And actually, some of the people who are some of my closest friends and who are the most accomplished people I know. I have a friend who just graduated from Harvard and he got accepted to Stanford Medical School, but he chose to delay that for 2 years to pursue, a master's in global health policy to address some of these population health challenges. So these are the people who will end up being sort of like leaders in their field for specific policy topics. And there's absolutely not one single path that is the quote unquote right path. You don't need to finish in 3 years. You don't need to finish even in 4 years, right? You just choose the path that calls out to you most and think about what are the things that you truly like care about. I think it's like absolutely ridiculous that some medications in the US are like $6,000 out of pocket and no one can afford that. And I myself have like, also had a lot of financial setbacks from like the high deductibles and high premiums that a lot of US health insurance plans are costing. So these are issues that fundamentally matter to me, and I am very driven to address that so other patients will have a lower, burden of financial hardships or have better access to healthcare. So think about what issues stand out to you most and give yourself grace to explore and to be flexible. So, for instance, I started off in neuroscience, and through many serendipitous um, things that happened, I ended up pivoting to public health. So, even though you might have a very strong conviction for why medicine or research calls out to you initially, be open to other opportunities and use your undergrad as an experience to explore both wet lab research, dry lab research, policy making, extracurriculars, and be open to new experiences. So I think I will leave it at that. And if you have any questions, I will be happy to take some.
Yes, thank you so much, David. And we'll be moving on to our Q&A period. I will also share the attendance link in the chat before I forget to do that. Um, and there are already a lot of questions in the chat, so I'll start reading them off and we can start answering them. Okay. How do you study epidemiology, population health? Do you use vast geographic and demographic data or current health issues studied by minority group or other methods? So I guess they're asking like the methods to study epidemiology.
Hmm. Yes, that's a great question. So, through my program, in my master's programs, I was able to gain a very strong methodological skill set. So I learned how to do basic statistical analysis using code like R or SAS or Stata, and do things like t-tests and chi-square tests, as well as more complex things, like different linear regression models or logistic Poisson regression models, and even more sort of complicated things like health econometrics. So looking at natural experiments and different modeling approaches. And so, what I would suggest is if you are interested in studying public health, when you get to university, um, if biostatistics or public health aren't sort of already baked into your required course load, I would definitely suggest taking some of those courses. I know biostatistics is probably not like the sexiest or like most, interesting course to a lot of people, but it's absolutely foundational to both research in wet lab research and dry lab research. Once I had this sort of foundational skill set, I was able to apply it to essentially any single database. And it's just a matter of finding the databases that support the questions that you're interested in. So how I do this is typically by keeping up with the literature. So pick a few journals that you're very interested in, and you'll see that different journals have different personalities. So for instance, JAMA is a clinical journal, a very high impact clinical journal. Lancet is a global health journal. Health Affairs is a health policy journal. And there are many, many others. So choose a handful of journals that are very interesting to you, and just, keep up with the literature. See if maybe there's like a study every week that you can read. I'll just typically browse the website every few days and see, if there's any new papers that come up. And if they're interesting questions, I will first then go to the methods of the paper. So not the results, not the intro, the methods. And I think that's really interesting because if I can take that same database that they use, I can then, think of different like spin-offs of that study or sort of different like how that database can then support my questions. So my advice to you, if you're interested in public health, take some formal training in courses like biostatistics, public health, and health like economics. And then regularly keep up with the literature and see what kind of questions um, pop up and what kind of data sets pop up. And don't be afraid of reaching out to people. When I first started off with research, I didn't know what I was doing. So I literally just cold emailed like 70 people and I was like, hey, I'm interested in neuroscience. Like, what can I do? And honestly, I got ghosted like by 69 out of those 70 people. But if you are someone who's like, hey, like I am, interested in health policy, I'm interested in prescription medication affordability. I was reading up on some literature on the Inflation Reduction Act and how that implemented a new out-of-pocket spending cap, and I'm very interested in how that spending cap then translates into out-of-pocket costs and prescription medication utilization. That is a very specific question, and people are a lot more likely to respond to you. After shifting to that new way of reaching out to people, I then got, like nearly everyone that I emailed responded to me. So, I mean, of course, I do recognize it is part of my privilege as a medical student, and I think part of them recognizing like, oh, medical students, I would want them to be involved in research, but also I think that different sort of framework, is also very important. And sort of changing, you know, um, your approach from being like, oh, like, is there anything I can help you out with being like, this is like what I'm interested in, and I want to explore these questions. Would you be interested in sort of creating a collaboration where we can do that together?
Yeah. The next question is, I guess this is related to your high school experience. So what were your high school grades like and extracurriculars? And did you do the IB program?
Yes, that's a great question. And I see that there's quite a few questions, so I'll try to limit my responses. So I did do the IB program in high school. I did three HL, so I did HL English, HL Chemistry, and HL French, I think, or something else. I don't remember entirely. My top six GPA was a 98, and I yeah, sorry, was there a second part of, oh, extracurriculars? Okay. And in high school, I think I was very involved in a lot of things that were centered around like the student body. So, for instance, I participated in student council. I was the grade representative for student council, and then I was president of student council. And then I was also involved in like different extracurriculars and clubs that advocated for health issues. So, for instance, like Operation Medical School, which sort of hosted these conferences for high school students interested in medicine, as well as sort of more like social oriented clubs and policies. So I can't remember exactly, but I think I was involved in. Um, I can't remember the name of the club, but just improving access to like clothing and like nutritious food and things for underrepresented students. So I think out of all of those experiences, I think like that was very important to me because there were like a lot of different clubs at our school and just not enough time at all. And this is something that I noticed in university as well, to like not enough time to do all of these different clubs that would have potentially looked good on my resume. But so instead of just doing like 10 different clubs, I chose like a small handful of things that truly stood out to me and I was truly passionate about. And I really like dug deep into those experiences. And so when it came time for medical school applications and research applications, I one had leadership sort of positions in those clubs. So it definitely looks better if you're, a leader in a few clubs versus just a member of like 20 different clubs. And secondly, I was able to sort of speak genuinely and like from the heart about, what I did in those clubs and like why it mattered to me and like what our mission was. And I think that like authenticity came out in like my application and people were genuinely like, oh, like he actually wanted to do something with this rather than just sort of, I guess, getting like credit for it.
Yeah. The next question is, so you finished your undergraduate in 3 years, and did your master's with the fourth year. I guess they're asking for like how you did your master's in the program and stuff.
Yeah, so as I mentioned before, after 3 years, so you have about 5 credits, I think, per year. So after your third year, you will have 15 credits, and that is the minimum number of credits that you have to take before being eligible to start medical school or graduate school. So at the start of my third year, I started applying for grad school and for med school. And so I sort of my plan was by the end of the year, I would have finished those 15 credits and then been eligible to start whichever program I get accepted to. So I did 3 years of bachelor's and then I did a 1 year master's. And then during my master's, I applied for MD PhD. And at the end of my master's, I started my MD PhD.
So you did your master's within that fourth year period.
Yeah, exactly.
Yeah. How hard was the MCAT and the master class?
Yeah, that's a good question. So the MCAT is definitely it's a monster for sure. It definitely requires a full summer of, dedicated studying. What I would recommend when I'm not sure where in your training you guys are, but I would definitely recommend like starting to study early for it and treating it as like a full-time job. I did a full-time internship on top of studying for the MCAT, which I would not recommend. I was literally studying, like doing Euro questions in between like PCR runs. And essentially, like the outcome of that was I was doing okay for my research position and I was doing okay for the MCAT, rather than just focusing on one thing at a time and just doing an excellent job in one. Your MCAT, it matters quite a bit for Canadian schools. It like the role of the MCAT sort of changes by school. So, for instance, there are some schools like McMaster Medical School who will only look at one section of your MCAT, which is the CARS. There's other schools like Toronto who use your MCAT essentially as like a threshold. So, if you meet some minimum threshold, then you're good to go. You move on to the next round, and then the MCAT isn't really a competitive factor beyond that. There's some schools like University of Ottawa who don't even look at MCAT, and there's some schools like Queen's who do look at MCAT but are very holistic. So I definitely like I had below, or I think I had like around average MCAT score of their matriculant, but definitely not like some like a sensational MCAT score. So it really does vary a lot for Canadian schools, but if you are ever interested in applying to US schools, it matters a lot. US schools are very metric centered. So, as someone who's actually part of the admissions committee for VCU this year, we definitely like quantify like which range of MCAT score you're in. We don't like look at every single MCAT score as like their own score, but we sort of bucket them into like certain buckets and we assign points based on the buckets. So, if you are interested in applying to US schools at all, or want to keep this as an open option, I would definitely recommend, getting trying your best to get a competitive MCAT score. And I think my best advice for that would be to treat it as a full-time job. Like spend a summer, spend like a few months, and just study for the MCAT. Like be very disciplined about it. Like be very like procedural about it. So like I'm gonna do like 20, 30, 40 Euro questions per day. I'm gonna read these chapters every day. I'm gonna keep testing myself. I'm gonna set goals for my score and try to see that incrementally increase. I would definitely suggest focusing full time on that. Because things like research and all of that, that is certainly important towards your application, but I think not as much as your MCAT. But I will also say your MCAT is not the be all end all. Like there are people I know who have just like average MCAT scores, but they have a very like unique story. So for instance, if they're interested in like Native American health, or they're interested in like substance use as I am, or they're interested in mental health. And that will be reflected to the people who review your application through your extracurriculars and through like your personal statement, or through your essays. So even if you don't have a strong MCAT score,